So next up, let me do a couple other just quick comments. One is when we think about individuals developing a hearing loss, many times we think of noise. And that's important because a lot of people using headphones nowadays where they didn't necessarily do that before. They're particularly loud. I got some myself. I got to be careful about that. But there are other factors too that may lead to challenges with hearing loss, and that's what our next presenter is going to talk about. This is Dr. Samson Jamesdaniel, one of the faculty members over at Cures also, who has become very interested in the relationship between kind of environmental exposures and hearing loss as well. And so he's going to talk a little bit about that. And that becomes important because that's important for those even during pregnancy and developing. There may be exposures that are occurring that might cause some difficulty. So with that, please, sir.
Good afternoon, everyone. So we heard a lot of information about deafness and hard of hearing. What I'm going to talk about is acquired hearing loss. So this is about hearing loss that people get once they grow up due to different types of exposures. And one of the common exposure that we all know that can lead to hearing loss is noise exposure. And it is one of the most pervasive pollutants in the urban environment. So we can maybe limit noise exposure. It is very difficult to totally prevent noise exposure. So that is one aspect that we know. But there are also a number of other factors that can contribute to hearing loss. So I'd like to share some of those things with you and some of the research, how those factors can interact and in turn aggravate the hearing loss. So if you can look at the handouts that is in your packet, there are some statistics that indicates how much of a problem is hearing loss here in the United States and also around the world. And this term, the acquired hearing loss, and particularly noise-induced hearing loss, came to the forefront, particularly during the industrial era, because of the huge noise exposures to the population. And today, if you can look at the statistics, almost 15% of Americans experience hearing loss, American adults. And if you look at the veterans, and if you look at the statistics regarding the disabilities, 14% of all disabilities are given to issues related to hearing loss. So that is a huge problem, not only in the civilian population, but also in the military population. So if you look at the agents that can cause hearing loss, I have listed few. So one is noise, another is chemicals and metals, vibration, pressure, drugs, and aging. So all of these can cause hearing loss, but in different degrees. Depends upon the exposure, depends upon whether they are isolated exposure or multiple exposures at the same time. So all of these agents can cause hearing loss. But usually, acquired hearing loss is not taken that much seriously because it is very gradual. You don't get a sudden hearing loss immediately after exposure. So people usually trivialize this acquired hearing loss. But it also has a number of adverse health effects. So noise, again, there are different types of noise that can cause different types of hearing loss. You have continuous noise, you have impulse noise, you have low-level noise. So all of these can affect hearing function. And then in terms of chemicals, if you look at the chemicals, a number of chemicals are known to be ototoxic. For example, one of the common things that we can relate to is lead exposure. How many of you know lead exposure can cause hearing loss? So yeah, some of you know and some of you don't know. Significant exposure to lead during childhood can adversely affect hearing, but when it's exposed in adults, it may not cause that much of a loss, hearing loss, when it is an isolated exposure. But the research that we have done indicates that when it is combined with other ototraumatic agents, for example, if you combine lead exposure with noise, which is prevalent in the urban environment, that can affect the hearing of adults. So similarly, there are a number of other chemicals and metals. Cadmium can cause noise, cadmium can cause hearing loss, and there are also organic solvents that we find in paint, so toluene, styrene, xylene. All of these also can cause hearing loss. So we should also know the exposure of these chemicals in our environment and make sure that we are not too much exposed to those kind of ototoxic agents. And then if you look at the occupational settings, whenever you have noise and also the chemicals, and in these occupational settings, you have also these other agents, particularly vibration, pressure. So employees who are working in a number of the industries are exposed to multiple ototraumatic agents. And then drugs, number of drugs. For example, I'm also working on a cancer drug known as cisplatin. It's a very good drug. It is being given to almost 20% of all cancer patients. So almost 20% of all cancer patients receive this drug either individually or as in a combination. But the side effect of this drug, one of the side effects is hearing loss. Particularly, as you know, cancer can be effectively treated for children in these days. So when the children are treated with this drug, they end up with hearing loss, and that affects their social integration, education, and as they grow up, it affects them a lot. So, number of drugs. So cisplatin is one drug. We also have antibiotics known as aminoglycosides. So gentamicin, kanamycin, some of you might have heard about it or might have taken those things. So those drugs can also cause hearing loss. And then aging. It's a normal process. So as we age, we lose hearing function. So these are some of the agents that can cause hearing loss. And then the hearing loss is also dependent upon the individual's susceptibility. For example, some of the habits that we can either increase the deterioration of hearing. So for example, if a person is smoking and also exposed to other ototraumatic agents, he may have a greater hearing loss than somebody who doesn't smoke. Diet. If you take a number of antioxidant-rich diets, that can help you in slowing down the hearing loss process, because the oxidative stress, which is what I do research on, is an important mechanism that contributes to hearing loss. Gender. I don't know how many of you know this. Women have a very good hearing because estrogen, which is a hormone, it has autoprotective function. So if you have a similar type of exposure to a male and a female, it will adversely affect the male than the female. So gender also plays a role. Age. The older you are or the younger you are, you have a greater susceptibility, because in those ages, the antioxidants are not that much. In the older ages, the antioxidant system is depleted in the inner ears, so those can contribute to hearing loss. Age and medications, as I said previously. So I have a couple of graphs, if you can look at that. So that is the data that we collected in our lab to prove that these agents interact or they work together to increase hearing loss. So what we have is what is known as auditory brainstem response. So you give a noise stimuli. So this is collected in experimental animals. So give a noise stimuli and record the transmission of the noise signals to the brain. So we use some electrodes, and so that is what is known as auditory brainstem response. So if you see in the figure, so what we have done is we have in the one on the left, we have the lead exposure and a control animal. So the blue trace that you see is the control, and the orange one is the lead exposure. And on the y-axis, you see the shift in the hearing function. So we actually measure that in terms of decibels. So if you see the control animal, there is not that much of a shift. But after lead exposure, the animal has a 10 to 15 decibel shift, which means it was able to hear a certain level of noise, but after the lead exposure, it only hears 15 decibels higher levels of noise. It was not able to hear lower levels of noise. So that indicated that lead induced the hearing loss. However, if you go to the graph on the right side, so that has a combined lead and noise, so which is the yellow trace that you see there. So that is significantly higher than what we have in the left. So that was the lead exposure, but when you combine that with noise, it is much higher. So that is a synergistic effect. So this can be true for many other autotraumatic agents. And as we know in the real environment, there is no isolated exposures. So you have all these regulations and the standards, but most of them are based on isolated exposures in laboratory settings where they are studied. But in the real environment, there is no such thing as isolated exposure because we always have complex exposures that interact with each other and then in that case, those regulations are not appropriate or helpful for us to prevent these adverse health effects. So that is one thing that we are trying to study there. And in another project that you can see down there, we are also looking at lead exposure right here in Detroit firefighters. So the map that you see is the Detroit map that on the left. So as you see there, it is color-coded. The darker shades indicate localities in which more than 90 or 95% of the housing was built prior to 1978, which means all of those houses are going to have lead paints. And as you know, there are lots of fire incidents, and our firefighters are highly susceptible to these exposures when they go in there. Even though they have their protective gear, but when they go in the second time to see if there are any remnant fires, they usually remove their protective gear. And probably that is the time they are exposed to these lead particles. So we are currently working with firefighters to see how much of a lead burden they have, and does it have any correlation with their hearing function? Because hearing is very critical for firefighting, so that is something that we are trying to study. And another aspect is genetic effects. We learned that we know that number of genes can contribute to susceptibility to hearing loss. So we are also trying to see if there are certain genetic changes that can lead to higher levels of hearing loss in these firefighters. So those are some of the things that we are studying. And as you all know, the best way to prevent or to protect yourself from hearing loss is avoid these autotraumatic agents, because the cells that actually help us to hear, which are known as the hair cells, inner hair cells and outer hair cells in the ear, they don't regenerate. Most of the other cells that we have regenerate, but these hair cells, once they are damaged and once they are gone, we cannot replenish them. So if you encounter an autotraumatic agent and if you end up with hearing loss, that is a permanent thing. So the best way to prevent this is to protect us from these autotraumatic agents. And that is what I want to share, and thank you.
So we'll take a few questions real quick. We have one, and then coming over to this table after that.
Thank you, Doctor, for that information. I am Theresa Landrum. I'm from the zip code of 4217. And back in 2010, we had held a huge health fair, working in conjunction with Dr. Mary Dureski from Wayne State. And when we had this health fair, we asked that hearing screenings be done and visual screenings be done, because the area that I am from was deemed once the most polluted zip code in the state of Michigan, #3 in the nation. And we had to fight Dr. Dureski and Wayne State to include hearing screening in the health fair, because not many scientists, not many doctors know that hearing loss can be environmentally related. So what's being done to get this information out that the environment that you live in, as far as cadmium, lead, arsenic, those things can contribute to hearing loss. We do have an area that is, and we know Detroit is heavily contaminated with brownfields because of the automotive industry and the factories that have died, and the land is still contaminated with lead. Our children are playing on those grounds. So our children are being exposed because the land has not been remediated. And as you said, back when I was a kid, we knew the deaf children. We knew the deaf children because the yellow bus would come and pick them up to take them to the deaf school. But we did not know that possibly the housing they lived in and the land they played on and the schools they went to had heavy lead. So the exposure and the deafness could have been caused possibly by some of those environmental issues. So what is being done to really get the word out there, to let the public know and doctors know that during hearing loss and even children being born deaf, that there could be an environmental factor. Because, I mean, this is just 2019, and we had to fight to get hearing loss screening and visual screening included in our health fair.
Yeah, I share that concern with you because people don't think hearing loss as a very catastrophic or a very adverse health event because it is sudden. It's not sudden, it is very gradual. So it is a challenge to bring awareness among the masses, but we are trying our best, and this is exactly one example that we have right here through Cures. We are trying to create awareness in the community that these environmental exposures are directly related to hearing function and can cause hearing loss. So this is how we are trying to spread the word. We also do these kind of research and try to publish them, and also work in collaboration with community members, like the project that we do with the Detroit firefighters. So those are some of the things that we are doing right now, but I'm pretty sure that these are not enough. We have to do a lot more in order to bring the awareness that is needed.
When you talk about the exposure of all these environmental things, are there some things that are worse than others? If you go into a house that has lead paint, if it's not cracking or falling off the walls, is that toxic just by breathing, just going into a room? And then you also have the, so I guess it follows suit that if I'm breathing this stuff, am I breathing enough? Touching, is that an exposure too by touching some of this stuff? I'm just not clear on how this exposure is getting into our body.
Yeah, in terms of lead, it can go also, it can be inhaled. The lead particles can be inhaled, but primarily it is by ingestion, because consuming those paint particles by children is the most common types of exposure. And in terms of their effect or the outcome, it depends upon the individual exposure or the particular type of agent that you are getting exposed. For example, if you look at lead, and if you are, it is expected to cause or affect the inner hair cells and outer hair cells in the high frequency region of the ear. So if you have a high frequency noise along with this lead, that's going to affect the high frequency region. Again, if you look at cadmium, that is known to affect the low frequency region. So if you have a low frequency noise plus a cadmium exposure, the low frequency hearing is going to be affected. So it depends upon the characteristics of the agent as well as the cumulative things that are being done.
And also to your question, so for those that have never seen me, you've probably got an email from me. My name is Brian Smith. I'm the one who you've probably got an email from or a phone call from about this event, and as far as the RSVP on the flyer. If you remember the flyer, we were actually supposed to have a third speaker today that was going to talk on that very issue about reducing lead exposure and toxins exposures in the home. It was Melissa Cooper Sargent from the Ecology Center. Unfortunately, she was ill, But she was still able to share some of the information that she was going to speak on. So everybody should have 2 copies of handouts from the Ecology Center, one specifically on lead and one on avoiding toxics in general. Because even though she could not be here this afternoon, she wanted to make sure the information got out. And we've also got plenty of extra copies. Next question.
What is the name of the drug that you were talking about that is used for cancer treatment?
That is known as cisplatin, C-I-S-P-L-A-T-I-N, cisplatin.
Okay, and I have a second question. How is paint and lead related in a correlation with hearing loss?
Okay, so lead actually is known to induce what is known as oxidative stress. So this is a mechanism by which cells can be damaged. So this is pretty common. So lead has been studied and has been found to induce oxidative stress. And when this oxidative stress happens in the inner ear, particularly in the neurons as well as the sensory receptor cells that are in the inner ear, they can damage the cells. So in terms of lead, more than the sensory receptor cells, it is neurotoxic. So it affects the neurons in the inner ear. One of the things that I would like to tell you is, if you just, how many of you have heard about the term hidden hearing loss? So most of us know that hearing loss, we have heard about hearing loss, but what is known, if I can explain hidden hearing loss, just let me talk about what is known as the jumbotron. Just imagine a jumbotron. You have all of those bulbs in there. So even if maybe 50% of the bulbs are not working, the jumbotron still can show some lights. But the message that is being conveyed by the jumbotron cannot be understood because part of the bulbs are not working. So lead exposure can cause a similar effect in the inner ear. So we have lots of neuronal synapses that transmit the signals. So lead may not affect the complete hearing, but it can affect some of those neuronal synapses. So the person can hear, but cannot clearly understand the message. But the noise level can be here. They can listen to that and they can hear the sound, but the message that is being conveyed cannot be understood. So that is known as hidden hearing loss. And this lead can affect the neurons. They may not have a bigger effect in terms of totally damaging the cells, but if they partly affect some of the synapses, that also can affect hearing function.
We got time for one more.
Yeah. So did you do a survey in New York with the subway system? Because that contains a whole lot of lead.
Yeah. We haven't done anything in New York, but I also don't remember people doing relating New York subway lead with hearing loss, but there are other studies in which they have related lead exposure to hearing loss.
No, that was more of a comment than a question. But hello everyone. My name is Lionel Bradford. I'm with an organization called the Greening of Detroit, which is a nonprofit here in town, and we are a tree planting organization, among other things. But getting to your question about play fields and kids playing in play fields that are contaminated with lead in the brown fields, we have been doing a lot of research, what's called dendroremediation, using woody plants to alleviate contaminants from soil, in our case trees. And what we found, we're still doing the research. It's tough to find funding to continue it, but we did get funding from the Forest Service, the U.S. Forest Service, to start that funding, that project. We have about 5 test sites around the city that we're working with, that we planted trees on. We're trying to see how these trees can alleviate these contaminants, mostly lead, arsenic, from the soil. We do core sampling on a quarterly basis to try and see what's going on. But what we found so far is that it's amazing how the trees are alleviating a lot of the contaminants from the soil. It's a 10-year project. We're only in the 4th year of it, so it continues to go. But I think it's something to be said about when you're looking at lead that's in soil and how it correlates with the trees that can alleviate those heavy metals. So just for you to know.